176 million women and girls worldwide suffer from a seemingly invisible disease that has no cure. I am Augusta Myers, and I am 1 in 10. Endometriosis is a disease that typically affects women and girls ages 13 to 49, but it has been found in girls as young as 8 years old. Endometriosis is when the lining of the uterus, the endometrium, which is normally found on the inside of the uterus, grows outside of the uterus. The endometrium, which is normally shed when a woman has her monthly cycle, now has no way to exit her body. It becomes trapped and creates endometrial implants and endometriomas, or chocolate cysts. Endometrial implants are lesions that can be found most commonly around the uterus and woman's reproductive system. But endometriosis has been found in every organ and anatomical structure in the human body, except for the spleen. Endometrial implants cause bleeding in the areas surrounding them, which causes inflammation, which leads to scar tissue, and adhesions that can cause infertility. These adhesions can also fuse organs together to completely distort the pelvic anatomy. Endometriosis is a lifelong disease that has no cure, and it takes an average of 7.5 years to diagnose from the moment a woman starts presenting symptoms of the disease. I was one of the lucky few women who was diagnosed within a year of arriving in an emergency department due to severe menstrual cramping. But I had severe pain for years before going to be seen. Dr. Neandra Pasal, a leading consulting gynecologist at London Gynecology, says that diagnoses are delayed due to the expectation that periods are meant to be painful anyways, and without a frame of reference, a woman may have nothing to compare her pain to. Endometriosis is also difficult to diagnose because it shares so many symptoms with other conditions, and the only official way to diagnose it is through laparoscopic surgery. Due to the length of time it takes to diagnose endometriosis, it also has severe psychological effects on women. And because endometriosis affects a woman's fertility, she has to cope with depression, anxiety, stress, and self-esteem issues. Endometriosis also causes painful intercourse, which leads to feelings of loss of sexuality and femininity. A study was done in 2013 where they interviewed 931 women with endometriosis. Their quality of life was being measured on an SF36V2, which is a tool for measuring the quality of life. And it was significantly decreased in all 8 dimensions compared to the scores of the normal U.S. population. These 8 dimensions are vitality, physical functioning, bodily pain, general health perceptions, physical role functioning, emotional role functioning, social role functioning, and mental health. Endometriosis has no known cure, but it has some effective treatment options, such as birth control, which has proven effective in many women in masking the severe pain women can get with endometriosis, or even prescribed pain medications. But make sure not to spend too much at brunch due to some of the severe side effects of these pain medications, such as nausea and vomiting. You will also not be able to drive while taking these medications, so many women on these pills have reported losing their sense of independence. If these medications work for you, that's great, but as I said earlier, these pills only mask the pain caused by endometriosis. They do not cure it, and it is not a suggested long-term treatment for endometriosis. A more invasive treatment option is for a laparoscopic surgery, and there are a few different methods for removal of endometriosis. You can coagulate or burn the implants with a fine heat gun or laser beam, or you can cut them away or excise with a fine heat gun or laser beam. Excision surgery takes more time than coagulation does, and it requires a specialist in endometriosis, but many women have stated that they have received complete relief from endometriosis from this surgery, and endometriosis has a much harder chance of growing back afterwards. There are many misconceptions surrounding endometriosis and effective treatments for this disease, and there is not enough known or enough funding to find a definitive cause of endometriosis. Here are some common treatment options that are not always effective for women with endometriosis. Pregnancy. Getting pregnant can sometimes help with pain during the pregnancy, and even prolonging breastfeeding can sometimes help. Doctors are still unsure why some women no longer have pain after pregnancy, and for a doctor to suggest to anyone to just get pregnant to fix a disease is bogus. Not to mention the fact that 50% of women with endometriosis struggle with fertility. The next is the Lupron shot. If you go through with the Lupron shot, it has all the same side effects as going through menopause. The aching bones, the hot flashes, and not to mention, it does not get rid of endometriosis. The Lupron shot was originally used for treating prostate cancer, so it is also considered a chemo treatment. Some doctors say it will clean everything up because it gets rid of your estrogen, which is what endometriosis feeds off of, but this is not the case. And the most common misconception of them all is that having a hysterectomy will cure endometriosis. There is no cure yet. And if you have a hysterectomy and the doctor does not remove all of the endometriosis, along with your uterus and ovaries, you can still have pain. Now, I know the women watching this may care, but the men probably aren't that interested. It doesn't affect you, you're probably thinking. But you're sadly mistaken. In research alone, the United States spends $1 per capita of women diagnosed with endometriosis. That's $7.5 million per year. But the total amount of money the United States spends each year on women with endometriosis, with direct and indirect costs such as loss of labor and healthcare costs, is around $11,497 per woman. That's a staggering $85 billion per year. Now, I know this was a long video, but this is a huge issue and it's something I struggle with every single day. If you or someone you know is in need of support and is struggling with endometriosis, there is help. In the description down below, I will leave a link to a Facebook support group. And for more information, the second link will be to the Endometriosis Foundation. Thank you.